This is a case of a large rupture anterior communicating artery aneurysm that was treated with balloon-assisted coiling. The patient is a 49-year-old male who was found unresponsive. On neurologically exam, he was intubated, localizing to pain on both sides, not following commands. CT of the head demonstrates severe subarachnoid hemorrhage and hydrocephalus. CTA demonstrates this large anterior communicating artery aneurysm. Once patient was stable and a ventricular drainage was placed, the patient was taken into the NG suite for endovascular management. Standard right femoral artery access was then obtained, and using a 6 French guide catheter, the right internal carotid artery was cannulated. Here you can see the guide catheter navigated into the distal portion of the internal carotid artery. Once we obtain appropriate access into the internal carotid artery, the first step is to bring up an intracranial balloon, in this case a transformer balloon. Using the microwire, as you can observe now, one of the A2 branches of the ipsilateral anterocerebral artery is catheterized. The balloon is then navigating all the way up into the base of the aneurysm. The coiled microcatheter is then navigated into the aneurysm. The microwire goes into the aneurysm, followed by the microcatheter, gently to prevent re-rupture of the aneurysm. The microwire is then removed, and the first coil is then inserted. Before the coil is deployed into the aneurysm, the balloon is inflated, as you can see here in this image. The coil is slowly advanced into the aneurysm. Positive pressure is held in the coiled microcatheter to stabilize, and see how the balloon is inflated further to prevent the coil mass from herniating into the anterior communicating artery. We continue deploying multiple aneurysms until obtain adequate obliteration of the aneurysm. Once we obtain adequate obliteration, the balloon is deflated very slowly to prevent any coil jumping into the parent vessel. Post-coiling runs demonstrate complete obliteration of the aneurysm and patency of both A2 branches.